Hello everyone, and welcome to another edition of Connecting with Kim here on Tampa Bay Arts and Education Network. We're so happy that you joined us today. I'm your host, Kim Droege. And you can also find the audio of our show on Sun Radio 96.3 FM and on your favorite streaming platform. And before we begin today's show and I introduce my guests, I want to give a shout out to my sponsor, the Spring of Tampa Bay, who provides all my on-air wardrobe, including jewelry and whatever, from their boutique at the corner of Swan and Henderson, the Spring Boutique. And I want you to go and visit them and make me very happy, because the net proceeds from the thrift store on North Willow, as well as the location on Swan and Henderson, go to support their mission. And what is their mission? The mission is providing sanctuary and services to survivors of domestic violence and their children. And they've been doing it a long time, and they do a really great job. So make me happy and support their mission. And you will find really great things there, because I can't keep everything that I find there. I wouldn't have enough closets in my house, but it's really, really great. So I'm so excited today because we have another newcomer on Connecting with Kim, and he's a great guy. I've known him for a while, and he's really super smart. And so I won't delay any further. I want to introduce you to Dr. Robert J. Applebaum, who works for Florida Eye Specialists and Cataract Institute, and his specialties are in cosmetic and reconstructive surgery for eyelids and face, and he also is an injectables expert, and we'll talk about that. So welcome to Connecting with Kim.
Thank you so much for having me, Kim. I'm very excited to be here.
It's my pleasure. So everyone who watches my show knows I always give my guests at the top of the show a few moments to share whatever they want to about their life journey, and you have so much to share. Because you just never know when somebody watching or listening out there is going to say, oh, I did that, or I went to school there, or, you know. And we want them to listen to the rest. So
cool.
Please share.
Sure. Well, I am from Tampa. I'm a Tampa native. I grew up in the South Tampa area near Hyde Park. And then I went to Berkeley prep school here in Town and Country. And then I spent a year at Georgetown for my freshman year of college, and then I transferred to UNC Chapel Hill and spent the next 3 years there. I went down to Gainesville to UF for med school, and then I spent a year after that doing my primary care training up in actually Virginia Tech up in Roanoke. Then I came back to Tampa, where I've been ever since. I did my ophthalmology or eye surgery training at USF, and then did an additional year of facial plastic surgery, focusing around the eyelids, also here in Tampa, with a surgeon named Jay Older, who was a wonderful mentor and teacher. And since then, I've been living in Tampa, about a mile from my parents, and I work in Tampa, Brandon, and Riverview. And that's at Florida Eye Specialists and Cataract Institute. And I've been doing and specialize in facial plastic surgery around the eyes. So,
but you have a lot of, you also hold an MBA.
I do.
Which I find tremendously interesting. Yeah. And then you also have some interesting personal, that you like skiing, I know.
I
do. You like to collect wine too.
I do. Yep.
Yeah.
I'd say
and you're a foodie.
Yeah, I'm a foodie, definitely. So I definitely like to travel for food. For wine, I like to collect wine. Skiing would definitely be my favorite sport, although it's a little hard to do in Tampa. So I like to play golf and tennis as well, and just kind of stay active and stay outside. And
well, look at you. I mean, you're like totally well-rounded person.
I try. I'm lucky I have a good group of people around me. It helps me.
Well, your dad was a doctor too, right?
Yes. Yeah, he's a cardiologist. Also practiced in Tampa for about a little over 40 years, and recently retiring.
Wonderful.
Or actually, getting close to retiring, actually. Not quite retired, but these cardiologists who've been practicing for 40 years, they don't like to stop.
Well, I think when you're passionate about what you do, it's very hard to stop.
I agree.
When you love it so much. So let's talk about, let's start off with, what do you do for a living? I mean, you have a lot of territory that you cover, so let's start there.
Absolutely. So when I say I'm an oculoplastic surgeon, it's people kind of have
their eyes glaze over?
Yeah, they have no idea what you're talking about. So it's somebody who has a background in ophthalmology and eyeball surgery, who then does a specialization in facial plastic surgery, and different oculoplastic surgeons do different areas of the face, but we primarily focus on the eyelids, so upper and lower lids, eyebrows, sometimes mid-face, sometimes lower face. My practice is really focused on kind of mid-face and up, so I do a lot of eyelid lifts, a lot of lower lid, fat removal, things like that. So a lot of rejuvenation, cosmetic surgery. But I'm also lucky because I get to see patients, do screening for skin cancers, especially around the eyes. Do a lot of reconstruction of there. I do a lot of work on tear ducts as well for excessive tearing, things like that. We do work on the eyebrows. And it's really neat because it's kind of a catch-all specialty. When people don't know what to do, I get to see the patient and kind of figure it out. So it ends up being a lot of fun. I get to do a lot of detective work, meet really nice, cool people, and I get to do surgery too, which I really enjoy.
Well, because Florida Eye Specialist and Cataract Institute is a huge firm. I mean, there's a lot of doctors there.
A lot of doctors.
I mean, I've been my parents were patients, and I'm a patient. So for various services there. So what got you interested in, this kind of doctor and this kind of surgery?
Yeah, so when I actually was finishing college and going to med school, my father introduced me to one of his friends, Dr. Mitch Drucker, who was my program director in residency, actually. And we just kind of talked about the eye and ophthalmology and what it was like. And my dad kind of knew I wanted to do surgery. He really didn't want me to spend 80 hours a week in the OR in the hospital. He thought that a specialty where I could have a life on the outside doing the not necessarily the one thing at the time, but interesting things on the side.
Yeah.
That I'd be able to do that. So I had the idea of ophthalmology in mind. I was able to pursue it in med school, really liked it, was very fortunate to get into the residency program at USF. And then when I was finishing up my eye surgery training, I sort of serendipitously met Dr. Older, or was introduced to Dr. Older, ended up applying for and getting a fellowship position with him. And that's how I got into facial plastics. And then that just kind of snowballed. Your career kind of takes you where you get to do different procedures and the types of patients I got to see, and so it allowed me to do the reconstructive stuff and also kind of veer towards the aesthetic side of things a lot as well.
So when you are you working now? You're not just working with adults; you're also working with children, right?
That's right.
So it's across the board. Your patients.
Yes.
Okay. So when you say reconstructive, would this be so? It does it cover everything from like if you were in an accident or if you had some kind of cancer and it caused them to. Okay. So it's all kinds of conditions.
All kinds of conditions. Yeah, across the board. And I do see adults and kids. I'll see little tiny babies who have born. So some for the oculoplastic stuff. A lot of times, or not that often, but often enough, little kids are born with things like droopy lids sometimes that you have to fix. And dealing with kids it's different usually than adults. The problems are caused by different things, so it ends up continuing to be interesting. But you can really help little kids develop properly, and so that's a lot of fun as well.
Well, I'd imagine for children. I mean, what you do for children, it's so fundamental because, let's face it. I mean, how you look these days is because of social media and whatnot has become even more important, and the opportunity to give a child the chance to live a more, and I'm going to use this word, more normal existence. I'm going to use that loosely because that's a loaded word.
Right, exactly.
That must be very fulfilling for you.
Oh, definitely. It is. And even with little kids, for instance, things like droopy lid, things like damage to the eye can really affect the development of the vision a lot more than it does in adults. So being able to have them look better, more symmetric, I like to use that term a lot, but also to see better and actually develop proper vision is really wonderful. And sometimes I get to see the kids when they're older and grown up, and it's fun.
Oh, that's wonderful. I would hope that they would bring them back if you rendered such an important service to their lives, that they would bring them back, to let you see how well they've done. Because we don't think about, we think about, I think people think, oh, well, I go to the eye doctor because I have to wear contacts or glasses, or I have to have cataract surgery. I mean, when my parents got their cataracts done, I said, okay, let me get this straight. You get 20/20 vision again, and because they both had their eyelids done, I said, and you get a mini facelift. Okay, sign me up.
Yep,
exactly. Like, when can I do this?
Exactly. No, it's great. I tell people who don't yet need cataract surgery but are on the way, like, just wait till you have it done. You're going to wish you did it 10 years ago. Oh, and
I've had some girlfriends that have already had cataract surgery done, and I'm like, and I'm thinking, and my eye, the eye doctors at Florida eye specialist said, it's developing, but you don't need it yet. And I'm like, okay,
but when? I know.
Okay, so you do eye surgery, you do facial reconstruction surgery, you get involved in skin cancers, and what else do you do?
So I do cosmetic surgery. So cosmetic surgery of the eyelids is very common. People don't necessarily have eyelids that affect their vision, but they don't necessarily like the way they look. They wish the eyes were more open. That's upper lid surgery. It's called an upper lid blepharoplasty. It's a very, very common surgery, and I do probably 10 to 20 of those a week. So I'm a very high volume lid surgeon. And then a lot of times people have lower lids that are prominent. Usually it's caused by fat pads from inside the eye socket that move into the lower lids, and it's very common. A lot of it's genetic, and they can be very bothersome and very demoralizing for people.
Right.
And you'll see some people who are young in their 20s and 30s, and it's not an aging thing. It's just their parents needed the surgery, and they do too. And so I'll do young people, and that's very, very fulfilling because they come back and all of a sudden, the cheeks are smoother, the lids are smoother. They don't have this tired look. They don't have the dark circles under the eyes anymore, and it makes a big difference.
Well, and also I know a lot of people, like when my dad, he actually had, his eyelids were actually interfering with his vision.
Right.
And he had to have his eyelids done. Now, it was amazing because my mom and dad both had it done, but my dad looked so completely different to me after he had it done. I guess we just gotten used to that, you know, the eyelids.
Right.
I won't hesitate. If they're interfering, I'm like,
Yep.
that's it.
Yep.
You're going.
Yep, and he probably went back to looking more like himself before the eyelids became heavy and droopy and
Yeah,
with his
you know,
vision.
he did. But I remember, you know, when I walked in the house right after it was done and I saw him, I remember just kind of, you know, being shaken at first about how different he looked, and it was hard for me to believe that something small like that could make such a difference.
Oh yeah,
Yeah.
Oh, big time. And that's the best part about doing eyelid surgery, I think, is when we do it, it's a subtle change, but a dramatic change.
Yeah.
You don't change the way people look, but you do change the way people look. So
Yeah.
they come in, and it's not like, oh my gosh, you made this huge change, but you look different, you look better, you look more awake, things like that, which are really nice.
Well, I know you also are an injectable specialist, so we should probably
Yes.
cover what does
Yes.
injectables mean. And before we do that, I'll just reintroduce you as my guest on Connecting with Kim today. If you're just joining me, my guest is Dr. Robert Applebaum, who is who works for Florida Eye Specialists and Cataract Institute. And we're talking about the kinds of eye surgery that he does, that he performs, as well as now we're going to move into injectables, which we should probably cover in case people don't understand what that means.
Absolutely.
What does it mean?
So injectables are a broad range, and I've been talking about this a lot with people because thinking back 20 years ago, injectables pretty much just meant Botox, which is one of a group of what we call neurotoxins, which sound dangerous, but they're actually very safe. It's been around for decades. Very, very minimal risk of side effects, and those are injectables that we inject into muscles anywhere in the body. I do it in the face mostly, but actually you can inject into the neck. You do it, people can have Botox type medications for migraine. They can have it for muscle spasms. So you can actually do it for a lot of different reasons. Sometimes you'll have uncontrollable facial spasm that you can treat with Botox that nothing else works for. But most of the time when I do that type of injectable, it's for fine lines and wrinkles. And you inject it because wrinkles are caused by muscle movement. And the muscles pull on the skin, they cause the skin to bunch together, and they cause wrinkle development. And so you can inject the neurotoxins. There are several different types now, which is pretty cool. There's even a new one that's just recently on the market that's supposed to last twice as long. So mostly they last 3 months.
Yeah, it's going to last twice as long as Botox.
As Botox, yes.
So
And
have you already?
I have not used it yet. I have not gotten it yet, but I'm excited to try it. So that one, stay tuned for that one. The next time I see you, we'll talk about how much I like that one.
Oh, you're giving
Yeah,
my
I
secrets
know,
away.
I know.
Okay, I will just, in the interest of full disclosure, I will
Yes.
just say that I use injectables, and I don't have any problem admitting that.
Yep, I do too.
Yeah, and I think, you know, I've used Botox and then a lip filler, so
Yep.
we can talk about the rest of the injectables.
Yep. So then there's the filler class of injectables, of which there are now many. And
Yeah.
talking 20 years ago, there was pretty much just one brand and one type of filler, but now there is a range, multiple brands, multiple types, and it's really great. The injectable fillers, for the most part, are physical products that you inject into the body. They're very well studied and very safe, especially in the hands of a skilled injector. And you can add volume to areas of the face and really elsewhere in the body too. We do a lot of hands, we do necks sometimes. You can do earlobes even. where you're actually adding volumes to adding volume to areas where there's volume loss. So lips being very common, cheeks being very common, non-surgical nose job, which I do a lot of actually, where a patient just isn't quite ready for a surgery, but you can make subtle changes to the nose that actually make it appear smaller, straighter, and it's very interesting. You actually make it appear smaller by adding volume.
Really? Oh my gosh!
Yep.
I'm learning,
Yep.
folks. This is fantastic.
Yeah. So it's really fun. There's other types of fillers that actually cause the body to produce its own natural basement membrane products and actually and new collagen that actually help restore volume with the body's own natural tissues. And different fillers are more appropriate for different areas, more appropriate for different people who have different problems, different types of volume loss. So it's really fun these days being able to choose which products to use, to decide which ones are best for which people, and it's really cool. And then there's one other type of filler product that's technically not a filler product. It's actually an injectable for fat reduction. And it's appropriate in certain areas. We use it kind of all over the body for certain types of fat, but you'll see people who have naturally just kind of larger chin areas, and if that's fat, you can actually inject a product that'll help decrease the amount of fat that's there.
So what does it do? Just makes the fat go away?
Makes the fat go away. It dissolves the fat.
I know you and I have talked
body.
about neck for a long time, because so I was very surprised when you just said you could inject Botox into the neck.
Yes, yes, and it's not Botox, it's a different type of product, but it's an injectable that can actually help reduce fat. So we'll do, and jowls, for instance, very common, very effective in that area. So I really like that product in the right person. And it's a lot of fun to have all these choices and being able to do all these things for people.
Well, I think this has been an area that has received, well, not only, I mean, I think eye surgery too. I mean, what we're able to do with helping people preserve their vision today, which is so. I know some people that suffer from retinitis pigmentosa, and they. I think to have started out as a sighted person and then lose it gradually over time until you're completely blind is one set of circumstances. But I just think all that we can do to help preserve people's eyesight, it contributes to just their overall better life and functioning, right?
Absolutely.
And mental stimulation and that kind of thing. Because
absolutely.
Yeah. So, this is exciting. Well, the first time I came to see you, I went home and you make nice videos, I have to say.
Well,
and I watched your video and I said, I texted you and I said, you should have people watch this video before they come to see you. You should make it a check mark to say, because I learned so much from watching that video about what was possible and what the opportunities were.
And I'm going to start doing that thanks to you.
Oh, I think you should,
watch it and make more videos.
And make more videos, because you really, and you did it in such a beautiful way. I mean, it was, it was very easy to understand. You were, I thought it was great. Okay, so we have all these range of, and are the injectables are also used, well, I know also now you can use injectables for TMJ.
Yes, yes.
Which I have suffered from years.
Yes, and those are the neurotoxins. So Botox and similar products you can inject into the muscles that actually contribute to chewing. And TMJ is a multifactorial problem, of course, but for obvious reasons, when you weaken the muscles that affect chewing, it improves the TMJ, but it doesn't affect chewing. So
no, it doesn't.
Interestingly, people can still eat just fine. Yeah. But they have less pain.
Yeah, and they probably have less of it. I mean, I never go to sleep without my night guard in. I mean, I do not, because I've suffered from TMJ so badly from when I was very young, and I just do not go to sleep without my night guard. But it is amazing that I think that it probably helps with night grinding. You're not if they're more relaxed, the muscles relaxed, you're not night grinding.
Big time.
Which is, even if you have the appliance, you can tell that you're night grinding.
Well, and you see people who break their night guards.
Oh,
and it decreases the night grinding tremendously in a lot of people.
Yeah.
And the more you do it, the more effective it is. So doing it every 3 months, making sure that you stay on schedule really helps.
I have not been on schedule. Tell me what else. You do a lot of things, so I want to make sure that we cover, because this is all about you, so I think we ought to cover what else you're up to.
I like that. Interestingly, just talking about the injectable and the aesthetics kind of things, I'm actually opening a med spa, which I'm very, very excited about. It's going to be in Riverview. My goal is to open more than one, but to start with one and make it great. And like we talk about, kind of like we've been talking about the injectables, the aesthetics, the movement, the trend in plastic surgery these days is really for subtle changes.
Right.
people to age gracefully, to change things, but not dramatically change things. You don't want to look like your face has been puffed up. You don't want to look like you've had a facelift where your face is so stretched that you can't even blink anymore. So that's going to be our goal. My goal, I'm working with some great people. We're going to have some great injectors, great laser technicians, people, estheticians. I'm very excited about the laser side of things too. So we'll be doing all the injectables, but the laser side of things is a lot of fun, and I wanted to mention that too today, actually.
Well, now, okay, so let me back up. So this is going to be in Riverview. Is it going to be near where your office is in Riverview?
It will, yes.
Okay, and so tell me all the services this med spa is going to do.
So in the med spa, right, so all the injectables, so everything we talked about, laser hair removal, which is huge for people. I can say that I've actually had laser hair removal on arms, back, neck. I have, for nobody in my family has any body hair but me, but I got it all. So I have arms, back, neck, laser hair, and it's been wonderful. And I actually had it done at a wonderful place here in Tampa called Perfectly Bare Laser. I work with them, and they're wonderful. So shout out to Joyce, because I've had such a great experience. And then I'll have my own down about 30 minutes from there in Riverview. So we'll be doing that. We're going to be doing tattoo removal, which I know is really big for people, and we're excited. We're going to really try to focus on being able to treat all skin types, so skin types 1 through 6, so as Caucasian as possible, all the way to African American, Indian, darker skin types, which there's not as many treatments out there available, so we're really going to focus on that a lot. Cool. We're going to do things like the Morpheus 8, which is a microneedling radio frequency device. We'll do regular microneedling, things like PRP, which is where you take your own blood and actually remove the serum or the liquid part of it, and it has growth factors and cytokines, and you are able to put that on the face or inject it on the face elsewhere in the body and inject that, so it helps with healing, skin rejuvenation, hair growth, things like that.
Wow.
Yeah, so, and then regular esthetician services, facials, massage, IV treatments, things that we really want to focus on, things that really benefit patients. We don't want to try to sell things that aren't going to help. We really want to try and do the right thing. And then in my office in Brandon, my main office actually, I'm very excited because we have a brand new CO2 laser, which is your medical grade facial, so your ultimate facial, which is basically CO2 laser resurfacing, so the skin resurfacing, fine lines and wrinkle improvement, helps improve skin tone. I do it a lot with my upper and lower lid surgeries to help with those things, and to help tighten the skin and just create a more youthful appearance. So that's a really fun device I've been able to use a lot recently, and I've been loving it.
Very cool. Now, when is the med spa going to be open?
It'll be open in about a month to a month and a half.
Wow.
So mid-May.
Oh my God.
Yeah,
see, I don't see you for a couple months, and then boom, there's like all this new information. It's wonderful.
Yeah.
So before we went on air, you also said that you wanted to touch on mental health issues.
Yes.
And I certainly think that's appropriate, because everything going on in life today affects your mental health.
Absolutely.
And there's a lot going on.
So yes, and I just like, anytime I get to be in front of people, I like to talk about it at least a little bit. But about 5 years ago, I lost one of my best friends to suicide, sadly, and he had a wonderful family and a wonderful group of people, and of course, he was the most wonderful person of all of us. So his family and friends, and unfortunately, I was able to be involved, and was fortunate to be involved in creating an organization in his honor called Love for Lawrence. And the goal that we have is to help reduce the stigma around mental health issues, and focusing on suicide because that's close to our hearts, but really on all mental health issues, to make it okay to talk about things. So what we do is multifactorial, and the organization has done really well over the past 5 years, fortunately, so we've been growing. But so far, we've spent a lot of time raising funds and supporting other organizations working with similar goals to us. And so we've supported organizations across the area, 6 figures in grants. We've had events. We've had 3 now signature events that have been wonderful. We've brought in some really excellent speakers to talk about their mental health journey. One of our speakers at this most recent one last fall was actually a skier, a professional skier, Drew Peterson, who was wonderful. We had some other wonderful speakers, but skiing, since I love it so much, he talked about his journey. We've been focusing on something called mental health first aid, and promoting and growing classes in mental health first aid in multiple states, which is a training course. It's basically like CPR for mental health crises. So how to help people going through a mental health crisis, how to basically keep them going, keep them safe until you can get them to a treatment center. You can bring in someone who is trained to actually help resolve the situation. So that's been really wonderful. So we've been really lucky, and we've been having some local events that we've previously called salons. We might change the name, but where we just have a group of people to have a conversation and bring in a speaker who's had something, who wants to talk about their mental health, whatever that journey is. And then we try to bring in a professional to talk about, kind of give their take on it, give their advice, and just let people chat and make it okay to talk about it. I've become very, very comfortable talking about it through the help of the organization and my friends and the support I've been fortunate enough to have. And so, we're happy to try to help, and we feel very fortunate to be around each other.
What a loving, wonderful tribute to this friend that you lost.
And this was, and I didn't mention his name, but his name is Lawrence Dimmitt, Lawrence Dimmitt the Fourth.
Yeah,
he's
I think
a
this is
wonderful human being.
So this bad thing that happened has a positive outcome, and what more could you ask for?
Exactly.
You'd want him back, obviously. I
Yeah.
get it. Just when I thought you couldn't get better, you do. Well, that's all we have time for today, so I want to thank you. My guest today on Connecting with Kim has been Dr. Robert J. Applebaum, who works for Florida Eye Specialists and Cataract Institute, and he's just an incredible man. I asked you, Google him and then read, because it's amazing. And he does, we've talked about his eye surgery, his facial reconstruction surgery. We've talked about injectables. So, and I like to cover, all kinds of topics on Connecting with Kim because I like to help people. So that's all we have time for today. Thank you for joining me. I'm your host, Kim Droege. You can find our audio of our show on Sun Radio 96.3 FM, and come back next week. We have another great edition of Connecting with Kim. So long.